morning. Welcome back to your hometown radio station, AM 1360 KOHU. It is time for the Odds and Ends program here on a Tuesday morning. We welcome you into the studio. We welcome you online at GoHermiston.com and Mixler.com/1360-KOHU. The web stream is powered by Blue Mountain Networks. We also welcome you to a full hour of local programming. We'll have it out to Delish Bistro at the bottom of the hour for the Chamber Business Connection. In the studio with us this morning, the director of the Umatilla County Public Health Department, Joe Famara, back on the show. Good morning to you.
Good morning.
How are we doing?
Doing pretty good this morning.
Healthy?
Healthy at home. Kids are healthy. That's always a big one because they usually like to bring it into the house.
County healthy?
County's doing okay. We're definitely seeing impacts of flu season. Right. That's we're definitely seeing some increases there.
Yeah. You talk about the kids and kids in school and flu and vaccinations. It all goes hand in hand. It all dovetails together. Because how far away are we from School Exclusion Day?
Yeah, so we're in February, right? And February is when School Exclusions Day hits. It was shifted this year. They shifted it a week to avoid the week with the holiday in it. And so it is now the fourth Wednesday of February, if I say that correctly.
Okay.
So for this year, we're looking at the 25th of February is going to be School Exclusion Day. And
somebody's not familiar. What is that?
Yeah, so what that is Oregon state law requires that's the date by which the paperwork around the vaccine requirements need to be on file with the schools. Otherwise, school administrators are required by Oregon law to exclude students from the classroom. So this is not the entire list of all vaccines that are out there. There are specific vaccines that meet this criteria. A common question I get are things about like influenza, flu vaccine, COVID vaccine, RSV. None of those are on the school required list, meaning if your child has not received a COVID or influenza vaccine, that will not exclude them from the school system. Common vaccines that are on the list are things like tetanus, pertussis, polio, varicella, chickenpox, measles, mumps, rubella, the MMR. Those are the types of vaccines that there are some requirements for based on the age of the child, and whether or not there's records on file as far as either the vaccine has been received or the process for the non-medical exemption has been completed.
So it is possible for somebody to not.
Correct. Yeah, and I'm always, obviously with the public health department, we recommend these vaccines, and in large portion we recommend these to everybody, but there is a process for parents who choose not to vaccinate their children. There is a process for getting all the paperwork completed, get everything tied into the system so that their children are not excluded on Exclusion Day later this month. And so there's a lot goes into this behind the scenes, right? There's a lot of work that parents do as far as responding to requests from the school to make sure the paperwork's up to date. The school administrators and the staff of the school do a lot of running around, collecting that data, getting it tied in with the Oregon system, oftentimes communicating with us at the health department, making sure they're reading things correctly and everything means what they think it means. And then our nurses running around behind the scenes, answering questions, tying up paperwork issues. Our goal is that no one gets excluded on the 25th of February. We don't want a single student being prevented from entering the classroom that day because of a record-keeping issue, right? And so I know letters were sent out, I think about a week or two ago, the initial batch of letters were sent out that as of that point in time, that's what the records looked like. And so folks who might have received a letter from our office are folks whose records had questions, records that were either missing some information or missing vaccinations, or we hadn't received any response to the inquiries that had been sent. And I do want to shout out, we typically send across Umatilla County about 500 or so of those letters every year. And then over the month or so between when the letters go out and exclusion day comes, there's a lot of work to help reduce that. This year, we actually had less letters go out. It was about 100 less than normal, which is great, right? That shows parents are on top of this. School staff members were on top of all this running around. And so we're really hopeful that that's going to help further reduce any children who do get excluded on the 25th.
Joe Famara with us, Director of UCo Health here on the Odds and Ends program. So you guys, are you the point on this for the county? Like you help the schools with the tracking piece, or
yes.
are the schools tracking and you're more in a supportive role? How do you look at that?
Yeah, so we are point of assistance for the schools, right? If that makes sense. So the state delegates to us the authority as far as interfacing with the schools, collecting the reports and data from the schools. It does get routed up to the state at a certain point, but we kind of comb through a lot of that and help make sure everything is looking as it's supposed to. The schools are ultimately responsible for doing this, but we're there to help make sure that they know what they're doing, they have guidance, they have help, and you know, there is a piece of that where if in a world, and this doesn't typically happen, but in a world where a school was being, let's just say, difficult to work with or refusing to work with us, you know, we are required to report that back to the state, and then there are steps the state would take as far as making sure the school understands this is what the state laws are. And I do make that distinction because these are state laws, right? These are not items that we at the county or that the school officials have a choice as far as administering, right? There was a law that was passed, and we are complying with that. There have also been, other than the date change, there's been no changes in these over the last several years, right? There's been a lot of questions around things around the CDC and ACIP when it comes to vaccinations at the federal level and the Western States Pact, you know, all these other pieces moving. None of that has actually impacted the state law around the school immunization requirements. There are still the same vaccines that are listed as requirements to receive or to have the non-medical exemption paperwork filed for each of those on record. One of the places that usually two places that usually throw hurdles for families. The first is families who seek their medical care and receive their vaccines in Washington State. That's great. However, the reporting systems don't talk across state lines.
Okay.
And so for someone who goes to their local provider here in Hermiston and their child receives their vaccines, that data gets input into the state system. We're able to pull that for the schools, and it kind of automatically slides over for their child's record. If you go up to, say, Tri-Cities and receive a vaccine up there, your record will look like there's a gap. And so folks can sometimes get letters from us that we're missing information, and it may simply be that they've actually already done all of the steps. The paperwork just hasn't been submitted to an Oregon provider. And that can be completed either by providing it to the school, providing it to us at UCo Health, having your local provider enter it into the records. All of those are options and pathways to have those records completed. The second item is when people move into the area. This is an Oregon requirement. If somebody moves from, say, Washington or even further away, their child may come in and there may not have been the same requirements previously. And so hepatitis A is one of those where that's on the list for the school is the hepatitis A series of vaccinations. And that is not commonly found in the school system requirements in other states. And so that is one that tends where folks may come in and they met all the requirements in another state, but coming into Oregon, sometimes we have to catch them up with the hepatitis A vaccine. Those are kind of the two pieces that tend to trip people up.
So theoretically, somebody who is currently at risk of exclusion on the 25th, they've received a letter.
Hopefully they have, yes.
And now it's time to maybe if they're getting a vaccine catch-up, starting that process, where do you advise they go? How do you advise they do that?
So if you've got a local provider you trust and you enjoy going to see, I would recommend going and talking with them. You can always call us at UCo Health. We run our clinics in Hermiston and Pendleton, and we provide all of these vaccines for children. We also have our, at the high schools, the Pendleton High School and the Hermiston High School, we have our student-based health centers that also they can provide the vaccinations there. Benefit, of course, there, if your students are attending those schools, they don't actually have to get pulled out to be transported to the clinic. We can pull them out and give them the vaccine, have them right back in class really in just a few minutes. But those would be some of the easiest ways to access that for the students. And I do recommend parents check now. Nobody wants to get the call Wednesday morning that, hey, you dropped your student off at school, but now you got to come pick them up because they're not allowed to go into the classroom. And a requirement stays there until that requirement is met, whether they receive their vaccine or the non-medical exemption paperwork is completed.
Where do they get non-medical exemption paperwork if they're going to do that? Is that through you or is that through the school?
We can definitely help with that. So it's the way the process is set up. There's some forms online, and there are some training videos or consultations from a provider that have to be provided. And the way Oregon has set this up, for each and every disease that's being protected against, there's I think what they call like a training piece. There's like a short video you have to watch and then fill out some paperwork that you acknowledge that you've watched the videos or received consultation from a medical provider, and you understand some of the possible implications of not doing the vaccination. Obviously, those come from things like, increased risk if there is exposure to certain diseases, but it also can result in exclusions from schools based on exposures. And so we ran into this issue with some students last year when we had a fairly large pertussis outbreak in some of our schools. And the way the laws are written is the school administrator actually has to exclude any non-vaccinated student who was exposed to the disease for up to 21 days, which is the possible incubation period. And that can really impact a family if suddenly your son or daughter has to be excluded from physically being at the school for nearly a month.
Joe Famar with us, Director of the Umatilla County Public Health Department here on the Odds and Ends program. It's 8:18 on AM 1360 KOHU. So the School Exclusion Day is coming up on Wednesday the 25th here of this month. And theoretically, you have received your notice if you're one of the 400 or so who are at risk of hitting that exclusion day and need to update. It sounds like in a lot of cases just update with your Washington
it can vary.
Immunization
Sometimes
stuff.
It is a very simple fix, which is why we really try to do a lot of this work ahead of time so it doesn't cause any issues.
We started with the flu numbers are creeping up a little bit. When you look at kind of the overall, I guess, what's telling right now? Is it the wastewater testing? Is it the people being seen? What numbers are catching your attention?
Yeah, so it's actually both. So as we've gone into this season so far, and the numbers in Region 9, which is where Umatilla County is included, that are put out by OHA, those numbers have been elevated. It's kind of the eastern kind of piece of the state. And those numbers have been up and have been creeping up, and then in the latest report has them making another jump up to about 25%, almost 25% positivity. And so what I've been doing is watching those numbers, which are actual tests being performed on folks at certain surveillance sites, and then I've been comparing them to some of the wastewater numbers. And up until really the last week or so, the data we've had has been more sporadic in our area, which tells me it was really kind of other counties or other locations in our region that were kind of driving the numbers up. We're really starting to see these show up in the wastewater numbers now. And so it kind of matches up with the surveillance testing that's happening. And so that really tells me this is definitely stepping up in the last week or so in our area, and probably will for the next couple of weeks, just given how long this tends to cycle.
So that's That's the flu, that's the COVID, that's the RSV,
It's
right?
really flu I'm talking about here.
Okay.
I mean, we're watching that for COVID and RSV. The COVID and RSV numbers have not really jumped up. They're relatively low. Influenza is what we're seeing jump up right now. Mostly in influenza A. Predominantly, it is the H3 strain, which is admittedly not the best match with the vaccine this year. But there is a good number of the H1N1 strain as well, which the vaccine does protect against. And so the vaccine is by no means not worth your time. And even for the H3, there's
even
a lot of...
still here in February?
Even still in February, because, I can't say you're going to be exposed tomorrow versus a month from now, right?
Sure.
I mean, it's obviously the timing is best, 3-4 weeks ago. But if somebody just hasn't managed to do it, my recommendation would be to get it in now if you're trying to protect folks or you've got concerns about that impact.
When you look at the wastewater data, are there certain things that kind of spike an alarm? I wonder, because there have been a few different very spotty measles cases on the west side, but one of them was in, I think, Benton County. It was Corvallis area, and they just saw it in wastewater first before they had even detected it with a person. Yeah,
so the state is monitoring the wastewater for measles. We have hypothesized that would be a good kind of early warning mechanism for kind of helping to alert healthcare providers, alerting providers to be watching for measles cases. One thing I want folks to realize or understand, especially in our area, most of our providers have never actually physically diagnosed or physically seen a measles case. I mean, it has become so rare that most of our providers have not seen it before. They know it clinically, they know what it looks like, they know how to test for it, but,
sure.
But they haven't necessarily had a positive case that they've diagnosed in the past. And so watching the wastewater is a great way to kind of prime them that, hey, there is evidence that this is something that should definitely be on your radar in your local community, something to be watching for. It has been spotty with measles. Some of the challenges with the wastewater data is it means something entered the system, right? Maybe it's somebody who lives there. Maybe it was somebody who passed through and just used a bathroom at a rest stop on the way through town, right? So it doesn't really give us a pinpoint of, hey, there's a measles case here right now today, but it does tell us it passed through the area, and so we kind of use it with that knowledge in mind.
But is measles one of those kind of the most heightened alert things you guys have right now in public? I mean, is a concern
probably
it
at the
spread so
moment?
quickly?
Yeah, I mean, probably at the moment, measles is. I believe, or at least I'm pretty sure, the most contagious disease we have, right, that we're aware of. I mean, we used to measure COVID. We used to measure how contagious COVID was against how contagious measles is, right? Like that's kind of the scale we use.
Yeah.
It's extremely contagious. It's airborne. It lingers in the area. If you and I were sitting here having this conversation and one of us was contagious with measles, anybody who comes into this room in the next 2 hours after I would leave would also be exposed to it, right? Like it is very contagious. So it's definitely something we really worry about, especially for youth and kids, where you can get some really significant complications in the hospital and deaths. I mean, some of the outbreaks they had in Texas and in East Coast somewhere, they've got another one going on. It has resulted in some deaths of children, multiple hospitalizations. All of that we're looking to avoid. And it's a huge amount of work to trace that type of disease. As you can imagine, somebody who pops in let's say a gas station convenience store off of the interstate. How many people go through one of those places in a 2-hour period?
Right.
The numbers can get very, very high very quickly. What's helped us is the vaccine is extremely effective. It is one of our most effective vaccines. I think the official numbers is something like 97, 98% effective, which is, and we have traditionally had a very high vaccination rates. I mean, our Umatilla County has traditionally been around 94, 95, 96% coverage of children, because that's what our numbers look at. So that's really all I can speak to, which has really protected us and does protect some of those communities where if somebody does transiently pass through the area, if everybody who comes into contact with them is vaccinated, we're unlikely to have any cases that spread from that. But as we've seen some of these vaccination levels drop a little bit, and we have, since COVID, we've seen little step downs, a couple percents or so stepping down as folks have been more concerned, nervous, a lot more misinformation around vaccinations. It allows pockets for something like measles to show up and take hold. And the west side of the state has had to deal with that a lot more than we have. Historically, their vaccination levels have not been as high as ours. The rural counties have actually historically been very good vaccinators for these childhood vaccines. And we're hoping to keep that up because that's really our best defense against this, but we're definitely watching the surveillance. We take note every time there is an alert, every time there is an additional case that we see somewhere nearby. That's something we're watching. We're talking with providers. We're communicating. And we've had some folks in the area where providers have done some tests, right? Like there's been this maybe looks like it could be measles, among other things. Let's run a test and make sure. Mm-hmm. All of those have come back negative, right? And that's good, but it's also good that our providers are watching this. It's on their minds, and they're watching for it.
It's Joe Famara with us, Director of the Umatilla County Public Health Department, here on the Odds and Ends program on AM 1360 KOHU. You guys had that focus in January on tobacco cessation.
Yeah.
How did you feel like the campaign went?
Felt like it went pretty good. We are, I think I mentioned this before, but we're primed to launch some tobacco cessation counseling. I know staff, all the certifications have come back valid, and so I think any day, I think we're announcing that will have started. In fact, I think I had an email yesterday where I need to give like final approval on one of the protocols that was laid out. But we are right there and excited to be able to offer that service for folks. And that's just as simple as going to the clinic or contacting? So that would be contacting the office. Main line number works for everything, 541-278-5432. You can also always reach us via the website, UCoHealth.net. But yeah, we'll be setting up appointments, and I believe the first meeting will be in person, but I believe like some of the other sessions, I think like remote access is something that's being set up for that. I don't want to speak too far into that as I'm not the one actually doing that. But we're really excited to be able to launch that really probably just in a matter of days. Perfect. Thank you, Joe. Thank you. Joe Famara with us here on the Odds and Ends program. We're getting it out to Delish Bistro. I hear plates clanking with forks, so they'll tell you what they're eating today as they come back with the Chamber Business Connection next here. It's your hometown radio station, AM 1360 at KOHU, and online at GoHermiston.com and Mixler.com/1360-KOHU. I'll be back at noon with news and agribusiness.